past few years, lawmakers have sought ways to address the rising costs of health care. A bill to create a Prescription Drug Price Transparency Act is now law, and I spoke with the bill's author, Senator Julie Rosen.
On May 12th, Governor Walz signed the Prescription Drug Price Transparency Act into law. How will this help Minnesotans afford their medicine?
Well, thank you very much, Shannon, for this opportunity to talk about the Drug Pricing Transparency Bill, a bill that's been in the works for 2 years now, a bipartisan bill. Very, very proud of this. And basically, it's just going to make drug manufacturers subject to the same price transparency that hospitals, providers, and health plans are subject to. They have to explain why they have a huge price increase.
So, as I understand it, this law will require drug makers to provide a detailed rationale for any large price increase on a drug that costs more than $100 for a 30-day supply. For example, a couple years ago, prices on EpiPens just went through the roof. And if something like that were to happen again, then the drug maker would have to come to the state and explain why the price was going up. Is that right?
More importantly, come to the state and the consumer why the price went up by 10% in 1 year and 16% over 2 years. So they can still have a price increase. And people fail to understand that. They can still increase their prices, but if it goes over 10% in a year, you have to explain that. And you mentioned the EpiPen. I think that's a great example. Went from $100 to more than $600 in 2016. The naloxone opioid overdose, $4,100 a dose. And that was just 4 years ago, $575 a dose. Bedazerone, which is for multiple sclerosis, $90,000 annually. And in 1997, listed at $10,000 annually. So why, since 1997, did it go up that amount? Those are really good examples of drug pricing that's gone out of control.
So with this law in place then, if there's a huge, a percentage increase beyond what is allowed, they have to say, this is why. What recourse does the state have to their explanation? Is there any recourse?
No, there really isn't. There is no penalty. There's nothing. It's just the consumer has the recourse. The consumer is the one that says enough. But no, it just basically is a bill to be transparent about why these price increases. And you can, like I said, you can certainly have that price increase up to 10% where you don't have to report. But anything over that, you need to justify that huge price increase.
So the idea then is to shed some light and prevent price gouging when there's perhaps a sudden demand for a drug that maybe had been less in use, and suddenly there's going to be a surge in how much usage there is, and to prevent these companies from trying to cash in on that fact.
Absolutely. And that's a perfect, I have an article for a perfect example of what you're saying. And it came out March 19th of this year. And it's the only drug maker with the potential treatment for the coronavirus, the chloroquine, the anti-malarial, that went up almost 100% in January. And they basically got shamed, and people found out about it. And so they lowered the price. But that is the type of behavior that we are trying to make more accountable and transparent.
So many states have been trying to get at this price transparency issue with prescription drugs. Will what Minnesota has done be something for other states to replicate?
Yes, absolutely. And there's been about 5, 6 other states that have done the same thing. And we've taken pieces out and created our own bill. Like I said, it's a very bipartisan bill. A lot of collaboration around the table with the drug makers, big pharma around the table, and the health plans. And we feel very good about this. It could be a poster child for other states to go after because everyone signed off on it. They're not happy, but everyone signed off.
Senator Julie Rosen, it's always a pleasure. Thank you.
Thank you very much, Shannon. Nice to see you.